Hello and welcome to the health program on Trust Television, where we delve into critical topics affecting our health and well-being. I am Aisha, Salihu. Our focus today is on improving cancer survival in Nigeria and exploring advancements in cancer treatments. I have joining me in the studio Dr. Faith Abodunrin, a hematologist and oncologist, and also Dr. Hassan Mohammed, a public health expert. Let's dive right in. Welcome to the program.
Thank you for having me.
Now, Nigeria faces significant challenges in cancer survival. According to the World Health Organization, the survival rate for cancer patients in Nigeria is alarmingly low, with a dismal ratio of 1.5. Now, I'd like to hear from you, Dr. Hassan. Let me start right with you. What would you say are the main challenges faced by cancer patients in Nigeria when it comes to survival?
Thank you for having me. Good evening, you all. Well, cancer survival, that's a phenomenon that is affected by a whole lot of factors. Right? You have medical factors, you have your social factors, and economic factors as well. Now, the cancer diagnosis is it's a big one for people who have it and their families as well. So when that diagnosis is made or when the symptoms appear, a whole lot of things can begin to crop up from the home or from the domestic situation that eventually have a bearing on how well people do. One big factor is the speed with which decisions to seek care are made. If there is a delay significant enough to allow the disease to progress until it gets to a point where only little can be done medically, outcomes are affected negatively. Now, second point is, where do you seek care? Because there's not a lot of standard practice around here. People have alternatives. People may go for traditional remedies, people go faith-based, and not that there's anything wrong with that, and eventually those have impact on how well people survive. And then there is the financial aspect. Treatments may be expensive beyond the reach of average households, and all of this working together, it's not just one thing, it's a whole lot of them. Another less often mentioned fact is availability of specialists. Cancer is not just one disease. There are different kinds of cancers, and then you need different specialists for all of it. So in the event that you don't have a specialist to cater to a particular cancer, the prognosis or the outcomes become poor as well. So these are some of the factors that revolve around making the outcomes of cancer patients poor as they are.
Thank you so much, Dr. Hassan. You have listed quite a number of challenges. I'd like to hear from you, Dr. Faith. What would you say, how can early detection improve survival outcome?
Thank you very much for that question. Just to piggyback off what Dr. Hassan said, a lot of times when patients come, they have come at a stage where the cancer is very advanced, and we know that people who are diagnosed early are more likely to do well. So that means that in a place like Nigeria, early detection and prevention is extremely important. And so I'll give an example. For instance, we know in breast cancer, doing mammograms are one of the safest and probably also a cheap tool in diagnosing breast cancer very early. Another thing is something called a colonoscopy, which is where we look through the colons to see if somebody has maybe a growth that is maybe not cancer yet, but might be cancer down the road. So those are some of the things I think early detection is for sure the best way in a setting like Nigeria to get ahead of cancer.
I like that you said that, but then again, we keep saying early detection, but in Nigeria where healthcare is actually relatively expensive, I would like to put that, how do we preach this gospel of early detection, encouraging people to want to go to the hospital to access these services, get tested, get their diagnosis right? How do we push forward this narrative? in spite of the financial implication?
I think that's a very excellent question. In a place like Nigeria, we would say that our government really need to put a lot of funds into setting up schemes that would encourage screening. So it can be things that even with our local primary care doctors and GPs, we need to start speaking about this early. So for instance, if a patient comes to you as a family doctor, as a family physician, you should be telling them that I'm encouraging you to get your breast cancer screening done, or I'm encouraging you to get a colonoscopy done. Or let me speak about patients who maybe in their families there was somebody who had cancer. I would highly encourage that if you have a family member who developed cancer maybe before the age of 60 at an early age, you should really be thinking strongly about testing and early detection.
Dr. Hassan, earlier you talked about how there are different doctors for different types of cancer. I'm still talking about the survival rate. I'd like to hear from you. Are there specific initiatives or programs that you'd say are aimed at improving survival rates in Nigeria at the moment?
Yeah, there are quite a number, most of which are run by non-governmental organizations, and then there is the often periodic once in a while talk about vaccination for vaccine preventable cancers. Well, one of the big cancers in Nigeria is vaccine preventable, that's cervical cancer.
Right.
Then once in a while, yeah, government agencies talk about young ladies, young girls and men as well getting the human papillomavirus vaccine. So those are some of those programs that go on frequently or periodically. But to add to what she said about what we can do to reduce the mortality, so to say, from cancers, is one big thing about early detection. One big thing we can do is to talk about it more often so that people are aware of what cancers are. There is that vagueness and confusion about what a cancer is, and then there is the denial. People deny it when the symptoms come. But if people knew that it's not exactly a death sentence, right, so they'd be more willing to get care early, and then they'd be taught, if they are taught to recognize symptoms, like when you see certain changes on the skin. For example, if you're taking the prevalent breast cancer in women, when you see certain changes, it may be time to do a self-breast examination. There are things you can do at home, then immediately get in touch with your primary care physician and then seek a mammogram thereby and get in the process. So because the figures for cervical cancer, for example, presenting early, you get a 5-year mortality of around 92%. For people who, if there is early prevention, after 5 years, 92% of people will still be alive. But if presentation is late, after 5 years, that falls to around 12%. So that's a big gap.
Okay, now let me still stick with you, Dr. Hassan. Let's look at the role of access to quality healthcare. We know that in Nigeria today, access to quality healthcare is costly, and in even some rural areas, you may not really have access to quality healthcare. How does that play a huge role in survival rate for cancer in Nigeria?
Yes, one of the big shock I had being a medical student was the day I heard that healthcare is not cheap. There's no healthcare that's cheap, right? If you look at it, I mean even getting paracetamol for headaches is not cheap. If you look at the discomfort you get from a headache, even though paracetamol is very affordable. So what we need to change is our mindset towards it. It's not cheap everywhere, but we need to pull in funds. So we need to start looking at creative ways of pulling in funds into our health sector. There is the health insurance models, because if we went with the out-of-pocket model where you pay for your health care from what you have, not very many people will be able to afford it in any society. So we now have to start looking at creative ways of funding healthcare, maybe putting substantial amounts like the WHO and United Nations have prescribed, putting substantial amounts of our national budgets into healthcare and into education. So, you know, that kind of eases the burden and makes access better for people, for a larger number of people.
Yeah. What then would you suggest an individual does to increase their rate of cancer survival?
Well, there are things we can do on our own. Things we can do, like Dr. Faith mentioned, the best thing for us in this part of the world is to focus on prevention. There are clearly preventable cancers. Cervical cancer being one of them is a sexually transmitted infection which eventually leads to a cancer. There are lifestyles to avoid. Hepatitis and liver cancer is also caused by a virus, the HBV and the HCV virus. So you shouldn't be sharing needles, drugs. I mean, sexual lifestyle should be responsible. Certain things like cigarettes and alcohol increase double the risk of any cancer, any part of the body. You know, those are things we can look at. Diet, exposure at work. I mean, that government should come in as well. There are industries that deal with very heavy chemicals. I mean, those kind of places should be having prevention modalities for people who work there. You know, screening programs for prevalent cancers in our society should be looked upon and then made prominent. So those kind of things can be done, and then people should be taught, or people should seek knowledge of the early signs of different kinds of cancers.
All right.
Yeah.
Dr. Faith, I couldn't help but notice you nodding seriously in support. I'd like to hear more.
Yeah, I honestly just agree with all of what Dr. Hassan has said. In terms of Nigeria, we know that early detection, that is where our goal is, and prevention. So just to also add, for instance, with breast cancer, there's been a link with obesity and inactivity. So if you can, as an individual, do physical exercise, that's something that's also helpful. Smoking is a big no-no for lung cancer. We know that that's associated with also pancreatic cancer, so cancer of the pancreas. So those are some of the things that we can do to prevent cancer. And I just also wanted to add the level of, if you had a family member who maybe had cancer, some cancers are also genetically passed, they're inherited. So if you have a family member who had some kind of cancer, maybe prostate cancer for instance, you want to make sure that you get tested.
Still sticking with you, Dr. Faith, I'd like for us to talk about, say, the recent breakthroughs in cancer treatment globally. Awesome.
So there's so many breakthroughs in cancer medicine. I want to tell the audience that this is, I guess, an exciting and a promising time in the field. There's so much research that has been done. We know that historically the treatment for cancer has been chemotherapy, so chemo drugs, which are hard and very difficult drugs for a lot of patients to tolerate. But in the last 5, 10, 15 years, there are newer types of treatments that have come to play. So something, for instance, like immunotherapy. So immunotherapy is a kind of treatment that we give to our patients to teach our immune system to fight cancer better. So things like you'd hear about pembrolizumab and whatnot down the road, but immunotherapy, that's a very important thing that we're doing. We're also having targeted therapies. That is, we know that some cancer cells, the way they grow is that they find some genetic mutations. They find a way to be smarter than us to grow. So there are some medications that are in the market globally, again, that targets those mutations in cancer. So immunotherapy, targeted therapy, transplants, cellular therapies like CAR-T and whatnot. I'm happy to talk some more about this, but these are some of the advances that have been made globally.
Let me bring it to Dr. Hassan and now to Nigeria. I'd like to hear what are the Dr. Faith has actually listed quite a number of advancements in this treatment. What's the level of access for Nigerians at the moment?
Well, immune treatments generally, I mean, they're looking like they're the future because to just describe them, they're almost like a personal treatment, designer treatment, you know, designed for the individual. They're not general like your chemo or your radiation therapy. So it means they're really expensive and they require a lot of scientific work. You need to take samples, go through a whole lot of immunohistochemistry testings and all of that. You stratify the tumors, you know exactly what you want to attack, and then in a whole lot of cases you prepare your attack cells, you know. So that's a lot of money. We're not there yet. If you needed immunotherapy within Nigeria, you'll have to be able to afford it and look for it outside the shores. You know, they require a lot of science and all of that. So for now, I wouldn't say we have them, but things are changing. We have, for not all tumors would require that kind of treatment. Some tumors are surgically resected. You just need a surgeon, and then adjuvant chemotherapy or radiotherapy, those are available. Yeah, but for things like immunotherapy, well, we're not there yet, but hopefully in the next few years we'll start seeing people coming up with those things. Yeah.
How then can Nigeria bridge the gap in accessing advanced treatment?
Now, the way I see it, things that are very scientific are not just things you just go to the market and buy. You'll need to put your money into research, really. The people that have them have put in a lot of money in research. A whole lot of times the research doesn't yield immediately. It takes years, decades, but eventually they bring forth the results. So that's the first thing I'd do. I'd fund cancer research locally, a whole lot of money. You know, there's a lot of people within the field, and the monies getting to them would put some motivation in and release the creativity that is there. Now, so because we can't reinvent the wheel, we would also need to partner. In our bilateral relations, we need to be talking about health and medicines. I mean, COVID-19 taught us that lesson. We need to be partnering with other countries and putting in medical clauses. I remember one of the reasons why United States tore their relations with Cuba was because Cuba was doing well with treatments for lung cancer. So a benefit of towing those relationships was that United States got what Cuba could do for lung cancer. You know, those things need to come into our foreign relationships. Okay, now we're friends. If you have cure for this disease, you should let us have it. Those kind of things. Yeah.
I like that Dr. Hassan talked about United States of America. Now that brings me to Dr. Faith. I'd like to hear from you. What role do you think public health policies play in promoting access to cutting-edge treatments?
The public health policies do a lot, actually. I have seen, just because I work at the University of Chicago, for instance, and there we see where partnerships between academic institutions and the government actually help foster, you know, early prevention and detection, and those really good policies that help. Just to kind of buttress what Dr. Hassan was saying, collaborations is really going to be the future here, and we need institutions in the United States, elsewhere, collaborating with academic institutions here in Nigeria, working on kind of, you know, more sustainable and more locally developed and probably more cost-effective ways to treat cancer locally. So public health policies, as I said earlier, are very, very important.
Now, Dr. Hassan, do we see that happening in Nigeria anytime soon?
Yeah, to use what you said,
right.
and piggyback on what you just said. Yeah, you said local. We may have some things in our local environment. I mean, what I mean more directly is you will hear stories like, okay, you could use these herbs to cure these kinds of cancers or manage this kind of cancers. You could use this remedy, that remedy. We also should be looking at that. Do you know, I think the best results we can get is, like she said, collaboration. We need to collaborate on every level that we can within our society here, outside our society here. You know, everybody coming together to get the best out of it. Yes, that can happen if we see how seriously we need this and go for it.
Now, Dr. Faith, earlier you talked about the role of chemotherapy and how it has always been, say, the basic and most acknowledged form of treatment in Nigeria. I'd like to hear from you. What are the typical side effects of chemotherapy and radiation?
Yeah, so chemotherapy is not targeted therapy. So what that means is, if I were to give a patient chemo, it will attack everything. So it's not just going to go for the cancer cells. So it goes against cells that are rapidly growing. So that would include, for instance, someone's hair follicles, so they can be hair loss, or even the bone marrow, where you have it's the factory where you make most of your blood cells. So chemo can damage the bone marrow and make you low on your blood counts, which can become a very severe issue. Some people even develop something called neuropathy, so where they have numbness and tingling sensation in their hands and feet. And when you hear about numbness and tingling, you might think that it's nothing really serious, but it can be very detrimental to their everyday walking. Things as simple as writing or standing on their feet. People can even have balance issues as a result of neuropathy. So those are some of the side effects. So low blood counts, hair loss, neuropathy, numbness, tingling sensation, and then even in the short term, people have bad nausea, people have vomiting, people have other GI symptoms like diarrhea from that. And sadly, some chemo drugs have also been related to other kinds of cancers. So it's also possible that the chemo that we give you down the road might cause another cancer. So those are some of the side effects that we let our patients know.
So how then can patients manage these side effects during treatment?
That's a beautiful question. And I think that's where oncologists and other members of the care team and nurses and whatnot come into play. So things like nausea, we know because we've been using chemo drugs for so many years. Some of those drugs have been on the market for as much as 50 years, right? So we already know that a patient that's going to get, I guess, maybe something like 5-fluorouracil or oxaliplatin will have nausea. So before they even develop nausea, you can stay ahead of it by giving them anti-nausea medications before they even get into that. And also, as doctors, we just need to encourage our patients to complain. Tell us if something is wrong. If you're having nausea, if you're having vomiting, if you're having diarrhea, we want to know so that we have things that we can help you with ahead of time.
Now, Dr. Hassan, let me circle back to you now. What psychological support is available for patients undergoing treatment?
Well, in a systemic way, it's not available really. But what happens when diagnosis is made and people come to seek care is that it's incumbent on the caregiver, that's the cancer unit to which the patient is, where the patient is seeking care, to counsel. So you need a psycho-oncologist, or that's just a psychologist that works within that oncology setting, to guide these people, counsel them. First of all, cancer is not a death sentence. There's a lot of new therapies, there's a lot of advances in cancer therapy that people use, and the results are outstanding. Right. So once people are able to get beyond that mental block, that it's not a death sentence and things can be done medically, privately, and then get their families or their treatment support system along, so everybody's moving along the same direction, there's a lot that can be achieved, you know. And in that case, whatever comes up, the team is alerted early, and then any adverse events averted. Yes. So in a systemic way, that's what's available within the treatment context. The team that is giving the treatment counsels, provide a psycho treatment and all that to help the patient pull through that.
Now, just very quickly in conclusion, let me hear from you, Dr. Faith. What would you say are the strategies for maintaining quality of life during treatment, just very briefly?
So I think the first thing really is, as a person, you need to determine what your goals are for your care. There are some people that really don't want to go through the hassle of chemo and the sadness and everything that goes into it. And maybe for such people, just pain management is okay. Treating their symptoms and not really the cancer. So it might be something down the road we'll start talking about something called palliative care, where you're not really treating the cancer itself, because at this point you're not concerned about the quantity of the person's life, but really the quality. How well are they able to, just live their day-to-day life? So we have medications as oncologists that we can give to you for pain, for nausea, for even the neuropathy, for anything, any symptoms, and that's kind of how we support quality of life.
So let me hear from Dr. Hassan, very briefly.
Yeah. Sorry, remind me of the question.
I talked about strategies for maintaining quality of life during treatment.
Yeah. In addition to what she said, it gets to a point where all you care about is palliation, just quality of life. So, I'll go back to one point I'd made, what the people can do, what the cancer patient can do for themselves. Exercise, dieting, surrounding yourself with a helpful community, supportive support system, those help. Because yes, cancer is it's organic, it's an organ, it's the blood, it's breast or something in the body, but there are those psycho aspects to it, emotional aspects to any illness. So the better supported people are, the better outcomes they tend to have.
Thank you so much. That's quite an insightful one. Thank you so much, Dr. Faith, and also Dr. Hassan, for your insights on the program today.
Thanks for having us.
See you again.
And that concludes this week's episode of the program, Healthy Living on Trust Television. For comments, contributions, and suggestions, do well to follow and subscribe to all Trust TV social media handles. Download the Trust TV app on iOS and Android devices across their respective stores, and get live updates on the YouTube live stream and the website. Join us next time as we continue to explore subjects crucial to your health and well-being. I'm Aisha. Salihu. Thanks for your time.